The Korean War forced modern medicine into uncomfortable honesty. Despite antibiotics, evacuation helicopters, and standardized field dressings, survival often hinged on something far more basic: whether a wound was protected in a way that allowed the body to heal rather than fight its own treatment. In frozen valleys and muddy hills, medics learned that some modern bandages failed quietly. They dried wounds too fast, trapped contamination, or disrupted tissue that needed stability more than intervention. What most people do not realize is that this rediscovery echoed a practice medieval surgeons had relied on for centuries and then forgotten. If you value this kind of overlooked history, where past and modern experience collide in unexpected ways, consider subscribing to Echoes of Valor. This channel exists to examine what warfare actually teaches when theory breaks down. The treatment in question was not mystical, and it was not primitive. It was deliberate, conservative, and grounded in observation. The medieval practice of moist occlusion using honeyed or grease-based dressings sealed beneath linen. Stripped of romance, it was a system designed to protect tissue, limit infection, and let the body do most of the work. The Korean War revealed that modern wound care still had blind spots. By 1950, Western medicine believed it had surpassed pre-modern practices entirely. Germ theory was established. Sterilization was routine. Standard field dressings emphasized dryness, airflow, and frequent inspection. In controlled hospitals, this worked well. On Korean battlefields, it often did not. Cold slowed circulation. Evacuation delays were common. Dressings froze, hardened, or adhered to tissue. Frequent rebandaging disrupted fragile clotting. Medics noticed a pattern. Wounds left covered, warm and undisturbed, sometimes out of necessity rather than design, often fared better than those treated aggressively. This observation did not immediately change doctrine, but it forced practitioners to ask why older, less advanced methods had sometimes produced comparable outcomes. Medieval surgeons treated wounds as environments, not injuries. Medieval battlefield medicine is often dismissed as crude, but in reality many surgeons operated under constraints that were actually pretty similar to those faced in Korea. There was no imaging, limited anesthesia, delayed evacuation, and, a really high infection risk. Texts from figures like Henri de Mondeville and later Ambroise Paré show a consistent principle. After cleaning gross contamination, the wound was sealed, not exposed. Honey, animal fat, or oil was applied, then covered with linen and left in place. The goal was to maintain warmth, moisture, and stability. These surgeons did not understand bacteria, but, they understood outcomes. Wounds that dried cracked. Wounds that were disturbed bled. Wounds that stayed warm and moist healed faster. Honey and grease were not just folk remedies, but really functional materials. Honey was widely used because it inhibited spoilage and odor. Modern research confirms its antibacterial properties, but medieval surgeons did not need microscopes to see its effects. Grease and oils served a different role. They prevented desiccation and formed a physical barrier against dirt and insects. Linen, unlike modern gauze, did not shed fibers into wounds. It absorbed excess fluid without pulling moisture away entirely. The dressing was changed infrequently, reducing disturbance. This system worked not because it was antiseptic in the modern sense, but because it created a stable microenvironment, something modern wound care would only formalize centuries later. So why do modern bandages sometimes fail in austere conditions? Well, modern field dressings are really optimized for speed, sterility, and standardization. They assume rapid evacuation and controlled follow-up care. But when those assumptions fail, so can the treatment. Dry gauze, it adheres to tissue, and adhesives, they often fail in cold or moisture. Frequent inspection increases exposure. In Korea and later conflicts, medics saw that overhandling wounds increased complications. The medieval approach accepted that you could not constantly intervene. It prioritized protection over access. In environments where intervention is limited, that philosophy still holds. The body heals best when it is not constantly corrected. One of the most important lessons from both medieval practice and Korean War experience is restraint. Healing is not accelerated by constant interference. It is supported by stability. When tissue is kept warm, moist, and immobile, cellular repair proceeds efficiently. Disruption resets that process. Medieval surgeons learned this empirically. Korean war medics relearned it under pressure. Modern medicine eventually caught up. The concept of moist wound healing, which is now, standard in advanced care, actually echoes medieval logic almost exactly. Doctrine changed slowly, but the lesson endured. It would be inaccurate to say armies reverted to medieval methods. What happened instead was selective recovery. Occlusive dressings evolved. Emphasis shifted toward thermal management and reduced disturbance. These changes did not come from theory alone. They came from field reports, casualty outcomes, and honestly, some uncomfortable comparisons between expectation and reality. The medieval system did not beat modern bandages in ideal conditions. It outperformed them when conditions were poor and resources limited, the very situations where survival, matters most. Why this matters beyond history? Understanding this continuity matters because it challenges assumptions about progress. Technology advances, but principles endure. When those principles are forgotten, older knowledge regains relevance. For survivalists, medics, and historians alike, the lesson is the same. Effective care depends less on novelty than on alignment with human biology and environmental reality. The medieval wound treatment was not advanced for its time, it was appropriate. That is why it lasted. Why remembering this lesson still matters. War strips systems down to essentials. It reveals which practices survive contact with reality. The Korean War reminded modern medicine that it had not escaped the past as completely as it believed. By understanding why medieval wound care worked, and when it still does, we gain a clearer picture of how knowledge is lost and recovered. These are not curiosities. They are lessons written into human endurance. If you value this kind of careful, historically grounded analysis, subscribe to Echoes of Valor and share this video with others who care about understanding warfare beyond surface narratives. These lessons were learned over centuries, paid for in suffering, and they remain worth remembering.